Throughout history, medical professionals have gone through a process to identify, warn, monitor symptoms, and test those who have been exposed to an infectious disease such as COVID-19. Such actions have been successfully used by health officials during pandemics and epidemics, including the yellow fever outbreak of the 1800s, Spanish flu in 1918, the Asian flu in the 1950s, swine flu in 2009, and it is key in assisting the St. Charles County Department of Public Health in stopping the spread of COVID-19 in our community. The process works this way. Someone tests positive for the disease. They are interviewed by your local public health nurse, and information is gathered about who they've been in contact with for a period prior to testing positive and while exhibiting symptoms. The nurse asks who they've interacted with, where they've been, and what precautions they took when being around others. Those who have close contact with the person are asked to closely monitor their own symptoms. The nurse asks that person who they've had close contact with, and they may need to be tested. Tracing continues through the chain until the public health nurse finds no further risk of infection. Anyone who tests positive is immediately quarantined, and a nurse with the public health department continues to check in with those individuals. Everyone who is interviewed in the process is given recommendations for next steps to take and a list of available services if needed. This process enables our community to identify where and how infection is spreading. It enables the Department of Public Health to warn community residents about new disease hotspots and to inform local decision makers about how to keep our economy open and residents safe. How can you help? Wear a mask, practice social distancing, wash your hands often, sanitize common surfaces, limit close contact with those outside your household, and when you're around others, it helps to keep a log of where you've been and who you've been in contact with. If you do happen to contract the disease or are in close contact with someone else who contracts the disease, your notes will provide medical professionals at the Department of Public Health with the kind of detailed information they need to mitigate the spread of this disease. To learn more, visit sccmo.org/COVID.